We are joined on the line by a good friend of mine and a legislator here in the state of Georgia, Senator Dean Burke. Dr. Burke, of course, has been in the Georgia Senate since 2013. He's an ex officio member of the Agriculture and Consumer Affairs Committee, also an ex officio member of the Ethics Committee, a member of the Appropriations, Insurance and Labor, and Rules Committees, and the vice chairman of the Health and Human Services Committee. Thank you for joining us and making a few minutes for us, Dr. Burke.
Good to talk to you, Dustin.
Now, I understand that you guys are currently, your legislative session has been suspended. What exactly does that mean?
Well, our legislative session normally is 40 days. They're not necessarily concurrent. We do have what we call work days or committee days. But generally speaking, we finish up around the 1st of April, and this year the tentative calendar was for us to finish, I think, on April the 2nd. But because of the public health emergency, the Speaker and the Lieutenant Governor decided to put us in recess. So basically, we're on hold to be called back as soon as the public health emergency seems to have decreased and people feel like it's safe for groups to get back together.
Okay. So that occurred last Friday, the 13th, if I'm not mistaken, the end of the week last week. Is that right?
That's right. Friday was our last legislative day for this year so far. We did have a special session on Monday, but that was just for the purposes of confirming the governor's call for a public health emergency that gives him some special powers to deal with the public health situation. So that didn't count towards our legislative day, since that was considered a special session just for that one issue.
Okay. That makes sense. Well, speaking of the governor, I saw recently that he had approved, I guess is the best way to put it, signed an amended budget here in our state. According to this article that I have here from the AP, it included $100 million in emergency funding to combat COVID-19, which, as you explained it to me just a minute ago, is similar to the individual strains of the flu each year. The coronavirus, I think you said, is the cause of the sickness, and then COVID-19 is the disease. Am I classifying that right?
That's right. COVID-19 is what we're calling the clinical illness caused by the coronavirus. Okay.
Well, with Governor Kemp's emergency funding that was included in that budget, it was a mid-year amended budget that included $100 million in emergency funding. How would that work? How would that $100 million typically be distributed? Does that go to like health departments? Is that what that's for? Or is it for authorizing, the National Guard, or funding that they may need or something along those lines? How would that funding be used?
Well, the line in the budget was not specific as to exactly how it was to be spent. So the governor does have a pretty broad leeway, but the different agencies that are dealing with this issue, and the State Department of Public Health is the largest, but of course the Georgia Emergency Management, or GEMA, and the State Guard, even State Patrol and so forth, they're all going to have increased costs associated with the different pieces that they play in this response. So they'll have a lot of needs, and I suspect in what we call the big budget, which we haven't finished with yet, that we'll have to do when we go back into session. We'll probably even have more funds, because this is obviously going to cost the state a lot of money to deal with this crisis.
Sure. As we talked about just a moment ago, the virus itself is it's hit our state. According to the CDC today, Georgia has 197 confirmed cases. Only one confirmed death by the state so far, thankfully. And there are some confirmed cases here in southwest Georgia, but so far they are only confirmed, as best I understand it, in Lowndes and Dougherty counties. everybody seems to say the best way to combat the virus is to wash your hands frequently, limit your social interactions. If you feel sick, stay home. Are we doing enough following those guidelines to slow this thing down, in your opinion?
Well, I think for the most part we are. Now, the different media outlets seem to be showing different responses. I mean, there's been some concern that younger people may still be going out to bars. There was an article about the spring break in Central Florida that was still being well attended. I mean, I think limiting the group exposure to less than 10 people that President Trump mentioned in his news conference, I believe it was yesterday or the day before, I think seems to be the central theme that will give us the most bang for the buck of limiting the spread. That I think is the thing that is happening, but maybe not quite as quickly as I would hope.
Well, and I think just kind of shifting gears to the state of Florida, we saw yesterday that the governor down there issued an order effectively closing bars and any other place, nightclubs. And I kind of got the impression that was because, they had made the suggestion, but then maybe folks weren't following the suggestions, and that led to the governor taking a little bit more stringent step to limit the amount of people gathering together. Is that kind of the next step at the government level? I mean, I understand that you said when the big budget gets passed, there will be more money in there to help, fund what's going to cost the state a lot of money. As a legislator, is that what you see the state's next step as far as, providing funding for these different agencies to do their jobs, basically?
Well, that and basically kind of directing the state health services, the state of emergency that the governor declared, the health care or infectious disease response, that order that we confirmed on Monday gives the state a lot of leeway to direct health resources to where they need to go, help hospital systems, manage the problems. And right now, the highest numbers that seem to be affected seem to be in Metro Atlanta and then in Albany, with smaller outbreaks, I believe, in Augusta and Athens. But I think we're only, in the first inning of this thing, to be honest. I'm talking informally to my medical colleagues throughout the state, and most of them are seeing more cases that haven't been confirmed on the state numbers just because of the states are waiting until they have kind of been double tested to be confirmed.
Sure.
The health systems are treating people, with those initial positives.
And that was kind of my next question. We've heard, that schools would be out until the end of March and that, we need to kind of slow things down for a couple of weeks. But it seems as though that the timeline may be extended a little bit beyond that as far as this disease goes. So you said just a moment ago you thought maybe we were in the first inning. Do you think that relates to the timeline?
Yes. I think it probably will be at least 2 weeks before we see whether our social distancing, as it's called, is going to slow down the speed of spread. That's what we're trying to see. And right now, we still have a bottleneck in testing. There are a lot of people that need testing that don't have either haven't had the tests because of test limitations, or we're still waiting on the result. And I suspect by the middle of next week, that bottleneck will, because a lot of people are rolling out new testing options and facilities, I think that bottleneck will go away, and then we'll have a much better picture as to how fast it's spreading.
Okay.
What we're hoping for is, if you don't do anything, the people I've read said this thing is doubling in volume every 3 days. And, with this efforts towards social distancing with closing the schools and limiting group gatherings, hopefully that will slow that down, and that'll make a huge difference in the capacity of the medical community to be able to keep up with everything.
One final question about COVID-19, Dr. Burke. What advice would you give your constituents here in Southwest Georgia, both as a doctor and then also as a senator, besides if you have anything besides the standard, limit your distance and wash your hands?
Well, I think paying special attention to, protecting the elderly that may have chronic disease, respecting these limitation on visitation to nursing homes and assisted living facilities. Those are put in place to protect the most vulnerable, and we don't need to get irate because we can't see grandma. I mean, grandma needs to be protected from people that may have the virus but have no symptoms walking in the door innocently just to say hello. And so, I think just being patient that these restrictions are out there for good reasons and, just being a good sport about it. We're all at risk, but the serious illnesses seem to be limited to the elderly and those with chronic disease, and those are the ones we need to protect.
Absolutely. Well, is there anything else that we can expect out of this legislative session, not related to COVID-19, maybe that you've been working on or that we should look forward to?
Well, we've been working really hard on healthcare issues in general, and I think this pandemic has basically put everything else on the back burner. I think we'll be focused on getting that budget out when we go back. And if there, is a stable time frame where we can start looking at policy issues, I'm sure we will, but that would only be because these other issues are improved. So I hope we're able to do that. But at a minimum, we'll have to go back and fund the government for the next fiscal year, which starts in July. So we'll see.
So we'll just pray that everything gets better and we can start working on, the other things that are equally as important, but maybe not at the forefront right now.
That's exactly right, Dustin.
Okay. Well, Dr. Burke, thank you so very much for joining us here today. Senator Dr. Dean Burke, District 11 here in our state. I hope things are well with you and your family, sir, and we'll hope to talk to you soon.
All right. Take care.
Thank you. Bye-bye.
Thank you.